Assalamu alaikum. Good morning. I am Dr. Sagia Afrose, Associate Professor, Department of Pharmacology, Bashundhara Ad-din Medical College. Today I am going to discuss about anti-epileptic drugs. Before going to drug, I am going to tell about the epilepsy. What is epilepsy? The definition of epilepsy is a heterogeneous symptom complex of a chronic disorder that is characterized by recurrent seizure. It is the second common neurological disorder after stroke. Now, seizure. Seizure is a clinical symptoms and signs caused by abnormal electrical discharge within the cerebral cortex, or seizures are finite episode of brain dysfunction resulting from abnormal discharge of the cerebral neuron. Classification of seizure types. There are two categories of seizure. One is partial or focal seizure and another is generalized seizure. Partial seizures are simple partial seizure, complex partial seizure secondarily generalized. And what are the types of generalized seizure? Generalized seizures are generalized tonic-clonic seizure or grand mal, absent seizure or petit mal, tonic seizure, atonic seizure, clonic seizure, myoclonic seizure and infantile spasm. Now, I am going to tell about the classification of anti-epileptic drugs. Barbiturates or phenobarbital. According to mechanism of action, voltage sensitive sodium channel blocker, carbamazepine, oxcarbazepine, phenytoin, phosphenitoin and lamotrigine. T-type calcium channel blockers, ethosuximide, gabapentin, pregabalin. GABA potentiator, valproic acid, barbiturate, benzodiazepine and vigabatrin. Carbonic anhydrase inhibitors are topiramate, zonisamide and acetazolamide that are rarely used. Now, what are the etiology for epilepsy? Number 1, genetic or early developmental cause, that is sodium channel mutation and cerebral palsy. Number 2, that is unknown cause, and number 3, that is the structural or metabolic cause. The structural or metabolic causes are brain tumor, traumatic head injury, hypoglycemia, meningeal infection, stroke, rapid withdrawal of the alcohol from the alcoholics. Among them, 60% of the total seizures are convulsive related to the loss of consciousness. Among them, 1/3 is generalized and 2/3 is focal or partial, and remaining 40% are non-convulsive ex absence of the seizure, and here there is decrease the level of the consciousness. Now, carbamazepine, and what is the mechanism of action of carbamazepine? It blocks the sodium channel and inhibit the generation of the epileptic repetitive action potential in the epileptic focus and prevent their spread. What are the uses of the carbamazepine? Generalized tonic-clonic seizure, partial seizure, trigeminal neuralgia and bipolar disorder for the controlling of mania. What are the adverse effects of carbamazepine? That are vertigo, drowsiness, dizziness, diplopia, ataxia, GIT upset, depressed AV conduction, idiosyncratic reaction, erythematous skin rash, Stevens-Johnson syndrome, lupus-like syndrome, hepatitis, agranulocytosis, aplastic anemia, leukopenia, water retention, hyponatremia, fetal malformation, fall of blood pressure and cardiac arrhythmia. Now, phenytoin. What is the mechanism of action of phenytoin? The major action on several physiological systems, it alters the sodium and calcium conductance. At the therapeutic concentration, the major action of the phenytoin is to block the high frequency repetitive firing of the action potential by blocking the persistent sodium current in the epileptic focus. Reduction of the calcium permeability with inhibition of the calcium influx across the cell membrane, and inhibit a variety of calcium-induced secretory process, including the release of hormone and neurotransmitter that are excitatory neurotransmitter. Phenytoin also decrease the synaptic release of the glutamate and it enhance the release of the GABA. GABA is a major inhibitory neurotransmitter. Now, what are the indications for the phenytoin? Number 1, generalized tonic-clonic seizure, simple and complex partial seizure, status epilepticus. Occasionally it is used by slow IV infusion, and trigeminal neuralgia. In case of trigeminal neuralgia, phenytoin is the second choice of drug, and cardiac arrhythmia is the another indication of the phenytoin. Now, what are the adverse effects of phenytoin? At high plasma level, immediately it causes the depression of the cerebellar and vestibular system. Examples are ataxia, vertigo, diplopia, nystagmus, drowsiness, cognitive impairment. And in case of prolonged use, it may produce gum hypertrophy or gingival hypertrophy, hirsutism, coarsening of the facial feature, increase the folate metabolism, increase the vitamin D metabolism, so that it may cause megaloblastic anemia, osteoporosis, osteomalacia, and in case of pregnancy, it may causes the fetal hydantoin syndrome in case of fetus. Now, valproic acid. What is the mechanism of action of valproic acid? It blocks the high frequency repetitive firing of the action potential by blocking the persistent sodium current and blockade of the NMDA receptor mediated excitation. It increases the level of the GABA in brain, and by facilitating the glutamic acid decarboxylase, the enzyme is responsible for GABA synthesis and inhibitory effect on GABA transporter. At a very high concentration, valproic acid inhibits the GABA transaminase enzyme in brain and blocking the degradation of the GABA. Now, what are the indications for valproic acid? It is used in absent seizure, partial seizure, myoclonic seizure, tonic seizure, clonic seizure, atonic seizure, and occasionally in case of status epilepticus, in case of bipolar disorder and migraine prophylaxis. What are the adverse effects of valproic acid? It causes the GIT complaints in most of the cases. It causes the nausea, vomiting, abdominal pain, heartburn, and rarely it can causes the weight gain, increased appetite and hair loss. Hepatotoxicity is the another important adverse effect. Thrombocytopenia may occur, and during pregnancy it may causes spina bifida, cardiovascular, orofacial and digital abnormality. Now, ethosuximide. What are the indications for ethosuximide? It is the main drugs for the absent seizure. Ethosuximide and valproic acid are the drug of choice for absent seizure, and it is more effective than the lamotrigine. What are the adverse effects? It can causes gastric upset, abdominal pain, nausea, vomiting. Central nervous system adverse effects are headache, dizziness, agitation, euphoria, hiccup. Allergic reaction may also occur, and lupus like erythematosus can also occur. Gabapentin and pregabalin are the analogues of GABA, and sufficiently they are lipid soluble and cross the blood-brain barrier, and main action is inhibition of the voltage gated calcium channel and also facilitates the GABAergic transmission. The indications of these drugs are effective only on partial seizure, secondarily generalized seizure, neuropathic pain and anxiety. The adverse effects are somnolence, unsteadiness, dizziness and fatigue. Now, what is the status epilepticus? When the seizure activity occurs for more than 30 minutes or 2 or more seizure action occur without recovery the consciousness of the patient, then this condition is considered as status epilepticus. Recurrent tonic-clonic convulsion without recovery of the consciousness in between is a life-threatening medical emergency. Management. The immediate cardiovascular, respiratory, metabolic management is required as well as the pharmacological therapy. The drug options are IV diazepam, IV lorazepam, IV phosphonatoin or phenytoin, phenobarbital are also used in this condition. And absence seizure is another name is petit mal. The onset is generally occur in 3 to 5 years of the age and last until puberty or beyond puberty. It is characterized by both sudden onset and abrupt cessation. Self-limiting loss of consciousness is occur and duration is usually less than 10 seconds and rarely more than 45 seconds. Momentary loss of consciousness occurs and patient apparently freeze and stare in one direction. Little bilateral jerking occur and electroencephalogram or EEG shows the distinct 3 per second spike and wave pattern. The drug therapy are ethosuximide, valproic acid, lamotrigine and others like clonazepam, clobazam, etc. Febrile convulsion. In some children, especially under 5 years age, they develop convulsion during the episode of high fever, and this seizure may recur every time with high fever. Management is temperature should not be allowed to rise, paracetamol oral and external cooling. The best treatment of the febrile convulsion is a rectal diazepam. The dose is 0.5 milligram per kg per body weight. Thank you so much. That is all for today, and we will discuss another topic in next class.